little hardball talk. Let's play hardball. Right. As the saying goes, if you want to make an omelette, you have to crack a few eggs. Now, what I'm saying is that people in a healthcare respect, or any wage respect, are the eggs. Now, you're not cracking them, they're not taking it personally if you're cracking their eggs, because they're just, as I always say, in retaliation to any kind of like spirit or any kind of gusto or any kind of real talk or any kind of good stuff that comes from a individual as their customer, not their patient, customer. If you're their customer and they're the eggs and they're just doing their job, you don't take it out on them because they're just doing the job. But you have to crack the eggs and say to different faces, you don't agree with something. Mostly the best person to probably talk to is the consultant, but then the consultant's just a pen pushing, data reading individual that's reading markers on blood. Now, you cannot argue that some charities are in fact just schemes, right? Somebody's benefiting, everybody's benefiting money financially, so charities are schemes. Now, there's no better example of that than, say, sorry to drop you in it like this, but Choir with No Name, you provide a great service feeding people that might need feeding once a week and giving them life skills of singing, harmonising, especially musically. So it's an arts charity. You can't deny they do good stuff and they entertain people, but it's marked as a homeless charity. Not that a lot of, like, there are choirs and individuals and other charities that go out singing for that charity as a scheme, because mostly it pays people big wages and gets lottery funding and really doesn't solve anything about homelessness whatsoever. But that's a scheme. Charities are schemes. So Macmillan is a charity. Don't ever forget that that's a charity. Now, every customer that comes to Macmillan, in certain individual cases, you have to be hyper aware that they have been fouled. Like my mum, she broke her arm. She had something happen in her head in 2022. That's 4 years ago. Something happened there. She wasn't given proper treatment. They went, yeah, give her penicillin in A&E. So she went 10 days undiagnosed with something going on here, and they just get through some, shingles medication at her at Chelsea Westminster. But was she tested for shingles? No, she wasn't. I mean, was there a malignant tumour behind her eye, a little one? Has that been looked into even? No, 4 years later. Could it be malignant tumour? Could it be like a benign tumour, something that's not malignant, benign, whatever? Is it there still? I keep trying to go to somewhere else and have another look and see if they can get to the bottom of why she's still got pain there. But they said it was just neurological markers left over. But the point is, I digress. Schemes. She had broke her arm. She was falling over consistently for quite some time, for many years, to the point that my dad's like fainting in pubs because she's got two black eyes because she's like stacked it into a radiator. And it's like, we thought it was just because her balance was affected. And you can't deny that that started happening more frequently recently. So it's not to do with anything like, because you seem to go to a public house, oh, it's alcohol. Everybody trying to get to cut down on alcohol for years. But that wasn't the reason for her falling. They say that myeloma causes anemia, right? So she doesn't eat a lot of red meat anyway, or spinach, so maybe she's just got anemia. Anyway, they didn't diagnose her after taking blood in March last year when she fractured her arm in multiple places. They didn't diagnose her when they took blood when she had fractures on her pelvis. They didn't diagnose her when they found the other ones on her spine, been taking blood the whole time. So it was only when she broke her hip and she lands in a hospital and it gets infected that they diagnosed myeloma, which is very convenient, even though the ward was actually really unhygienic because they were totally obsessed with laxatives and giving people bowel movements after the surgery. Now, that's a simple observation to make, that they gave her the infection, and myeloma is a very nice cover up and a scheme for Macmillan. Now, my customer doesn't bode well with 25 cycles of chemo to knock out your immune system to stop myeloma attacking her marrow. Now, I can't help but just think in layman's terms of, if your body's overworking that much, that your blood is just doing a lot of work, and it's really doing a lot of work to heal those fractures, which causes delirium, which then can lead to dementia and other factors. But people are so quick to go dementia and label people with things, even though they're suffering extreme trauma from everything that's going on and being treated as a cancer patient after a hip fracture. And they were giving her untold medication in that ward that looked like it was killing her. I've got photos of her, and I'm like, oh my god, she looks like she's on her way out. She's opposite a morgue coming in here with a hip fracture, and it all felt totally unethical. There's a woman that's being basically visited by her children, whose name was Maureen, that then goes by Dolly. That then, and you feel like, is this some sort of like this ward is like some dramatic ward, and this is unethical for this particular customer. And she's listening to all this stuff going on, and she got moved to a side ward, and what was her fate? But you could see that the way that they were treating her, heavily medicating her, would make her lose her appetite, and then you'd naturally go downhill. And we've all seen it before. My nan went into hospital with a cough and died because they threw morphine on her, killed her appetite, bosh dead. It's like, you know what certain people do, and you know that the outcome could bode this way or that way. It's a fork in the road, and you can see it in front of your own two eyes that they're administering things that are actually killing certain customers because of their age. So it's like, okay, my mum's in this place. You say she's had a fall because you can't look at someone 24/7 in their side room. She's out of here. So I made sure that she knew what was going on. Mum, do you want self-discharge? Because she was losing her shit. You're giving her things like gabapentin, different things that affect your mind, that you're compounding what is delirium by giving extreme opiates that are going to feel that side of her, and it can make a person appear a certain way when they're not that way. Now she's out, she's liberated, and she's got freedom, but it's touch and go, because that scheme put Greenwich Council onto us. Phone calls. Do you know what will happen if your mother does not get her treatment? If her treatment had continued in that hospital where she was dangerously dehydrated in her side room one day, looking like that, you're like, how can you be dehydrated in a hospital? I mean, everything that's going on in front of me, are you just trying to be unethical? Are you trying to say that you're playing dice with my mother's life? Are you getting some sort of power trip out of this? I don't know, but it's scary to look at and be around. Anyway, she agrees with Zometa as a bone filling treatment for her osteo bones, which appear very much like myeloma bones, holes in them, exactly the same. So it's like, we agree with getting bone filler, but as far as chemo cycles over 2.5 years, pounding somebody's body unethically and knocking out their immune system goes for pharmaceutical companies, we're not sure about that side of it. And I had a frank and honest conversation about it, because it entails giving someone chemo pills at home for 21 days. And those chemo pills need to be taken with gastro-resistant pills, and those chemo pills then need other things that stop your blood from clotting morning and night. And I'm like, Mum, are you agreeing to do this? And she's like, I'm not sure. I'm like, well, I don't like it being in my hands, but let's have frank and honest conversations about it, because a lot of people agree that, you know, if you mineralize the body to a certain extent and keep your minerals well balanced, that disease doesn't exist anyway. And if you look at a lot of TED Talks, there's a lot of people that say that they've had incurable things, that they've just sorted it out with turkey tail, CBD, and other methodology, even though they were given terminal diagnosis. Now, my mum's is a terminal one because you can't cure it. All you can do is make your blood go into remission. Now, I said to the consultant, the scheme manager, my mum's blood was fine last time, so what does that exactly mean in terms of giving her more chemotherapy if her blood's fine? It doesn't make sense to me. If it's in remission, it's not attacking, and there's no markers for inflammation, why would you carry on and giving something to knock out her immune system? Because it's compromised by myeloma. Oh, right. It doesn't make sense to me. I would rather try these alternative things and get a Zometa. So anyway, they put social workers. We're concerned for your mother. Is she still going to the pub? Yes, because that's what life is. It's legal. She's enjoying her life. Like, back off. Fuck the fuck off. But yeah, it's a bit like that. It's like, that wasn't care. You put a short stint in her leg. Gone over 10 minutes.